Okay, just to review again, speech noise is a noise that is shaped, has a spectral shape that is very similar to speech. Okay, so it's a broadband sound. It's not a narrow band like we use for pure tones, and it's shown on the right. But it's not like a white noise, where white noise would have its energy all across here equally. So that's the biggest difference between a white noise and a speech noise. Speech noise is concentrated to mask the speech signal. So the plateau method is one that we use a lot when we're doing masking. And essentially, this is under masking here. So you have masking level in the non-test ear, 0, 10, 20, and then response to bone conduction simulation in the test ear. And you can see up into about 20 dB, there's no change. There's no effective masking because the threshold keeps changing. But then once you get to between here and here, you have a point where you have what we call effective masking, meaning that the bone conduction score is not changing as you increase the amount of masking. And then this is over masking, but don't worry about that for now. Focus on under masking and effective masking. Okay. Masking dilemma refers to the troublesome practical problem in which, when you just have to use so much masking in the non-test ear that it eventually masks the test ear. And this essentially occurs when enough masking is too much masking. Let's go through some audiograms. I want to talk about SRT related to audiograms as well. So again, when we're analyzing an audiogram, we want to look for different things: patient's age, what earphones or transducers we use, the reliability, see if the findings are normal. Again, we want to look at the right ear, left ear, we usually do air conduction, and then we do bone conduction, and then pay attention to your symbols. But let's go through some of these. So here's like the entire audiological evaluation in one graph. So here you have your audiogram, here you have your SRT, your word recognition, and then your pure tone average that they calculated. Okay, so we'll go through this. Here you have thresholds that are all normal. Let me go through this here. So 20 dB is essentially the normal range. So 250, 500, 1000 hertz are all within that normal hearing range. And then 2000, 3000, 4000, 6000, 8000 are all within the hearing impaired range. And so if you were to look at the air conduction versus bone conduction, you don't see any air bone gaps, right? So here you have your air conduction scores, your bone conduction scores. To have an air bone gap, it would have to look something like this, at least 15 dB more, right? Better, if you will. So again, no air bone gaps here, so we know it's not a conductive loss, okay? Or a mixed loss. So in this case, you have a mild sloping to severe or profound high frequency sensory neural hearing loss is how I would characterize this one. So then you look at your pure tone average versus your SRT. That's a comparison we always want to make. Calculate the pure tone average. You would do it by averaging your thresholds at 500, 1000, and 2000 in most cases, and then dividing by 3 for each ear. Okay, and then your pure tone, that's your pure tone average, and then again you want to compare it to your SRT and make sure it's within about 10 dB. Okay, here is your word recognition scores. Remember, they are in percentages. Okay. And so it gives you the dBHL that it was tested at. And then it also gives you how much masking was put in the opposite ear. So when you're looking at this one, right here, the right ear, it was right ear had 80 dB HL of sound, the left ear had 50 dB HL of masking. Okay, so that's how you interpret that. And they got 76% correct. Okay, here they got 80, which is fair. You know, if somebody gets between 90 and 100, it's excellent. 80 to 90 is good, or 80 to 89. 70 to 79 is fair. So these are on the border of good and fair word recognition scores. And everybody uses different descriptors, so don't get caught up in all the details with that. But, you know, 75 to 80% is good to fair. Or fair to good, I should say, word recognition scores. Okay, let's see this next one. I'm not able to move. Oh, wait, yeah, let me get rid of this. Okay, so let me go back. I think I skipped ahead, yeah. So this one here. Your SRT is 5 dB HL. Your word recognition score presented at 40 dB SL. Now, remember, when we're looking at sensation level, it's above your SRT. So in this case, if your SRT is 5 and you presented at 40 dB above that, you would have been presenting at 45 dB HL. Okay, so your sensation level is always the amount of decibels, if you will, above your SRT. So here your SRT is 10. That should be a capital B. Here's your SRT is 10. So here you're presenting at what? dBHL. 50 HL. Okay, and that's how you figure out from your SRT to your sensation level. And of course, all the scores for this one. This would be a normal hearing audiogram, but this shows how to calculate your word recognition level based on sensation level. But then also, if you took 5, 10, and 10, that's 25 divided by 3, which would be 8 point something, right? So that's within your, hold on, I lost my cursor here. That's within 10 dB, and the same thing for the other ear. Okay, so you can calculate and compare your SRT to your pure tone average. All right, let me get rid of this here. Okay, so let's see what we can do. So the right ear, let's always look at, excuse me, get my marker back up. Okay, so right ear, first thing to look at, these are unmasked scores. Okay, we say you can never tell if it's unmasked. You have to have at least one masked, because this tells you for sure that these are coming from the left ear. These have to be coming from the right ear. They can't come from the left ear, because here's the left ear scores. Okay, so usually it's the poorer ear. You have to be sure to mask, because if this one is coming from here, the left side, this one obviously can't be coming from the left side, so it has to be coming from the right side. That's a little complex, but when you have a big difference like this, you have to do masking in the worse ear, which they did. So if you look, it's a 10 dB, so there's no air-bone gaps. Does everybody see no air-bone gaps? First thing. Oftentimes, we won't do masking at 250. But if it's done, it's done. There's some issues with doing it at 250. So we usually do 500, 1,000, 2,000, and 4,000. I said masking. We don't normally do bone conduction at 250 hertz. So in the right ear here, you have let's say this is mild, sloping to moderately severe sensory neural hearing loss. And then in the left ear, you have a severe, flat sensory neural hearing loss in the left ear. Okay. Then you want to look at, okay, well, the SRT is 50 here. So 30 plus 50 is 80 plus 60. You could do the math. Actually, let me break out my calculator and do the math because I don't want to mess it up. It's early in the morning and I hadn't had all the coffee yet. So let's do the right ear. So we're at 30 plus 50 plus 60. 140 divided by 3. That gives us 46.7 or 47. A pure tone average of 47. So that's in alignment. That's within 10 of the right SRT. And then the left, we have 75 plus 75, plus 80 divided by 3. And so we have 76.6, so 77 as your pure tone average for the left ear. So those are in good agreement. Okay. And that's how we verify the reliability between the pure tones and speech audiometry. Now, in this case, 86 dB or 86%. So good word recognition in the right ear, fair word recognition in the left ear. Now they're presented at different dBSL levels. And the reason why this one's only presented at 25 dBSL is because as you get poorer hearing, you can't use as high a level to present your word rec because it becomes uncomfortable because of something we call recruitment, which we'll talk about later. But so if you tested at 50 dB HL, you had a 40 dB SL, you'd be testing at 90 HL. Does everybody get that? And then 75 plus 25 would be 100 HL. Okay. Okay. Let's do one more and I'm going to have you do the rest for an assignment. Okay, so let's go to the next one. I can't get my cursor to move. Okay. Oops. All right, so here we have, let me see, is there any earbone gaps? It's a little hard to see, but really no more than 10. Here, 45, 35, 35. Yeah, no. I don't see any earbone gaps. So here they calculated the pure tone average for you. You look at is it close to the SRT? Now what kind of hearing loss do we have? No earbone gaps, so this is sensory neural. We have a mild sloping to moderately severe sensory neural hearing loss. Word recognition scores were 80% presented at 40 dBSL, 76% presented at 40 dBSL. So kind of fair word recognition scores, sensory neural hearing loss bilaterally. Pure tone average in good agreement. So what I'd like you to do is the remainder of them, and I will email about the assignment that you'll have.